When we think of security systems, we think about being safe and secure in our homes. But what about feeling safe and secure in managing our health so that we can stay in our home longer? In healthcare, I'm suggesting we create something that's a huge paradigm shift, where we move from the security system that keeps people out of our homes to creating a new security system that helps people stay in their home safely and as long as possible. Good morning. My name is Rainey Link, and I'm a nurse educator at the University of Minnesota, and I work also at the Minneapolis VA Medical Center. In the morning when I'm getting ready for work, I'm here drinking my coffee and thinking a lot about what's going on in our profession, the different trends that are really going to transform our industry. And one of the things that I think about is the huge demographic changes that are coming. We're seeing that we're going to have a doubling of our population over age 65. That we had a population in 2007 of 35 million, and we're projecting in 2030 that we'll have a population of 70 million. What that translates into is that every single day for the next 15 years, 10,000 people are going to turn 65. That's every day for 15 years. And it's going to bring about a lot of changes. Some of our estimates are showing that we will need to triple our capacity of ICU beds in this country. We're also going to have to look at dramatically increasing the amount of memory care centers that can offer long-term care for adults with dementia. Our research shows that right now, Americans over the age of 65, 1 in 9 of them have dementia. And in our population of 85 and older, it's 1 in 3. So we see that there's a lot of needs in our healthcare system that we're going to have. But beyond all the specialty care, let's talk about just basic assisted living. You have an elderly family member who it just needs a little help with medications, kind of making sure they stay on track with their diet and are checked on regularly. Well, a 2014 study showed that the cost of that is $3,500 a month or $42,000 a year. That's an extraordinary expense for most families. And so if we can look at cheaper options that would allow family members to stay in their own homes longer and safely, well, everyone would benefit from that. So we have a lot of technology that could help us. And there's a lot of discussion right now about something called the Internet of Things. We've thought a lot about the internet and these kind of virtual spaces, connections being made in the cloud where people are communicating. But now with the Internet of Things, the internet is really something that we can physically walk through in a sense, because there's so many objects around us that are connected to the internet, and they can receive and transmit data, and they can really help create this safety net that we're talking about. We're talking about things like physical scales that patients weigh themselves on, pill bottles, sensors we could put on the toilet that would tell us how many times they flush, even home blood pressure cuffs that would immediately transmit information to a central location where nurses and other telehealth staff could really help interpret this information and guide care. What would that look like? Well, let's look at scales. To prevent heart failure exacerbations, it's really important to take daily weights. We can ensure that patients are doing that, and then we can look at the trends and see, oh, we're in trouble. Over the last 3 days, we see a patient that's gained 3 kilograms, and so we can intervene before there's a crisis. Now, putting a sensor on the toilet may be really out of the box thinking, and you may wonder, what on earth would that benefit? Well, once we establish how many times a patient flushes a toilet, we could look for unexpected changes. If they're suddenly doing it much less, that could be an indication of incontinence or dehydration. If we're seeing a big increase in the number of times that they're using the toilet, it could indicate infection, like a urinary tract infection, that could lead to complications such as acute confusion or even sepsis. We have a lot of tools now that would be very easy to use. This is a wrist blood pressure cuff. Very simple to put onto the wrist, press the buttons, and not only do you get a number right immediately, but those numbers are logged so that we can see trends that are going on in the patient to see if there are changes we need to address. Also, in terms of just taking your daily medications, we actually have systems now that can set up pill bottles or pill sets where if they're not opened on their date by a certain time, a light starts to flash on the pill bottle or on the pill grouping here. And if that still doesn't cue the patient, you can actually set up the system to automatically send you an email, a text, or even a phone call to remind you, hey, have you taken your morning or your evening meds? This is a huge thing that can really help patients and help them stay healthier and help them stay in their homes. So, as we're moving forward, there's a lot of opportunities if we're willing to get innovative and we're willing to really transform how we think about some of these systems. And so, as I go back to drinking my coffee and thinking about this, I'm going to be thinking about how I can turn this simple security system into something that could really transform the lives of many families across the country. Thank you.